I'm Dr. Ryan DeBell from The Movement Fix, and this is Movement Fix Monday, and we're gonna look at the beginning position of the psoas test that we looked at 2 weeks ago. If you haven't watched that video, check in the description on this YouTube video and I'll put it there. So we're gonna look at that starting position that we looked at 2 weeks ago, which looks like this. So you're laying on your back, both legs are straight, feet are basically flat toward the ceiling, and the knees are locked out. So when I made this video a couple weeks ago showing the test, which there's a band on your back, you touch one leg to the ground. I said that in a couple weeks we'd look at how do you get to that position if you have a hard time getting there. Because for most people that's not easy. When you do that seated, it's called a long sitting test, but we're gonna do it in that supine or on your back position. The first thing we gotta think about is that caused by a lack of hip joint mobility? And if you can lay on your back and bring your knee or your thigh past 90, it is not a mobility issue with your hip. If you can stand up flat on your feet, it's not an ankle mobility issue. So, and if you can lock your knees out, it's not a knee mobility issue. So we have to think about the tissue that goes along the back of the leg in completion. So that could be some of the anatomy trains like the superficial back line. We're also thinking about the nerves as they come out of the spinal cord, go into the sciatic nerve, into the leg. And then we're just thinking of all the muscles that cross those joints. So the first thing I'm gonna do to work on this is I'm gonna think about the neurologic or the nerve component. And so what I'll do is lay on my back. I'll have this leg bent, this leg will be straight. I'm gonna take my hands and put them behind my hamstring. Head goes down. And I'm just gonna do 10 ankle circles each direction. Once I do those 10, which kind of gets the nerves gliding through the leg, I'm gonna keep my hands on the back of my leg here. I'm gonna pull my knee so it's above or below 90 degrees at the hip. And then what I'm gonna do is actively use the muscles and basically using my quads to straighten my knee. And I'm gonna go as far as I can. I'm gonna do 10 reps here. And what I'm doing by doing this is I'm working on something called reciprocal inhibition. Basically, by using my quads, it is necessary for my brain to let my hamstrings lengthen. Because a lot of times this isn't a true mobility issue, the muscles aren't short. The brain doesn't know how to let the muscles lengthen. So by using my own muscles to create this sort of stretch, I'm looking more at the neurologic component in terms of muscle tone than I am, is the muscle technically short or is there a bunch of scar tissue in there? Once I've done 10 reps like that, what I'm gonna do is I'm gonna put my hands on the ground like this. I'm gonna do a crunch here, and I'm gonna press into the ground. I'm gonna bring my knee up, and then I'm gonna work on straightening my knee without my hands. So knees up this way, so my hips below 90, and then straighten it yourself. So you don't get any support here, and you're really teaching your brain how to do this. At that point, I'm going to repeat on the other leg. So ankle circles here, 10 reps like this. And then I'm going to go pressing into the ground, doing a crunch, and then straightening out. Okay, so after doing those, that'd be about 20 ankle circles each way, 20 with the hands behind your leg, and then, or 10 with the hands behind the leg, and then 10 on your own. I'm going to do something standing to sort of lock it in. Because I live standing, I move around standing, I lift weights standing. So I wanna make sure that I integrate it standing. And for that, I'm just gonna use a single leg deadlift, and you can do that with weight or without weight. And so what it would be like is I'm thinking about one point from the top of my head to the tip of my straight leg toe, and I'm just going to go as far as I can, hopefully breaking 90, so I'm in that kind of long sitting position, and I'm teaching my brain how to control this. You put your arms out if you wanna be like an airplane. I'm teaching my brain how to do this weight bearing. So I'd go 10 reps, 5 to 10 reps each leg, going as far as you can. So give those a try. That's not going to be an immediate change. That's going to take some time. You might have to do this for several months before you can achieve the position where you're on your back and your legs are straight. When we do the ankle circles, we're dealing with nerves, so don't go super aggressive. Just go nice and easy in those circles. And I might do this for 20 minutes, a couple times a week. I wouldn't do this really aggressively before I go deadlift or do some heavy lifting because I'm getting rid of some muscle tension that I may not want to get rid of right before I lift heavy. So give those a try. Next week, we're gonna look at some upper back and neck mobility stuff that we will see in that in that long sitting position. If you're laying there and your feet are up towards the ground and your head and your chin is jutting forward, we got to take a look at that and get that sorted out. Hey, if you haven't liked the Facebook page already, go to facebook.com/The Movement Fix. Like us there so you get all our updates. Subscribe to the YouTube channel and follow us on Instagram @The Movement Fix. See you guys next week.